Hello, everyone. I'm Mike Leventhal with Men's Health Network, and welcome to our first episode of our newest podcast series, My Cancer, My Plan. Today, we're going to hear from two guests. The first guest is Tom Butina, who is the Director of Oncology and Patient Solutions and Alliances Marketing at Pfizer, and the former governor of the state of Georgia, Roy Barnes. Let's get right to it. Thank you, Tom, for joining us. And just out of curiosity, what Lego project are you working on at the moment?
Yeah, thanks, Mike. Right now, Leo and I are trying to master the Home Alone house that was recently came out. So it's very fitting for this time of year, but it is something. He is 4 years old, so we are working through it.
Okay, Tom, let's just chop it up. What inspired Pfizer to create This Is Living with Cancer? And was there a specific moment or story that sparked the idea?
Yeah, no, that's a great question. And, I think back, I was just trying to, pull my thoughts together for today, our conversation together. And, we started this whole platform and campaign about 10 years ago. So we're going on a decade already. And it's hard to believe that it's something that I've been a part of for that entire decade. But when you look back at why this was created and why This Is Living with Cancer became a premier platform for Pfizer Oncology is because there was a need. There was a patient need flat out. We spent a lot of time back in 2016 doing a lot of market research. At that point, our portfolio wasn't as robust as it is now in the oncology space. And we had some great pipeline, different elements in our pipeline coming down. And we really wanted to be sure that we were understanding the needs of the patients who eventually would be potentially taking Pfizer medicine. And so this really started with a lot of research with patients and trying to understand what was missing, what is something that is missing from after diagnosis in terms of whole health resources, quality of life resources, and overall just what, in their opinion, was missing from this space. And overwhelmingly, they told us that there's a feeling of being overwhelmed, obviously, right? You get a cancer diagnosis and it's very overwhelming. It changes your life immediately once you hear that. The biggest thing that stood out to me was they didn't know who or what to trust. And so they, like all of us do, we hear something or we want to learn more about something. We go right to Google, we type it in and try and figure it out. And what they were telling us is that most of the information that was coming to them was pages and pages, and they didn't really understand if it was credible and trustworthy or if it was something that they needed to, just not pay attention to. So it was really hard for these patients to understand what is a credible piece of advice or information for them to, kind of digest while they're undergoing a cancer treatment. And then the third part was just them trying to find their new normal. They were just told they were diagnosed with cancer. They don't know what to trust or what information is correct. And they are striving to get back to a sense of where they felt before they had that diagnosis. And so putting that all together was really the genesis of creating a platform called This Is Living with Cancer.
Well, I know you've got no shortage of patients who want to share their stories. How did you select those individuals whose stories appear on the platform, and what criteria did you use to decide who was going to be part of the platform?
Yeah, the patients are really the soul of this platform. We use real patients. We don't pay actors to do commercials or to represent our brand. These are real people living with cancer. And it was really important to us at the beginning that we represented all different walks of life. So if you are on our platform and you're watching some of our patient stories and the people who have contributed to our platform, you'll see young and old, you'll see different races, different geographies, rural and urban. And so it was really important to us that we were able to showcase that if somebody, let's say, was in their early 30s, had a young family, and unfortunately heard the news of a diagnosis, that they had someone they can relate to. But also we wanted to make sure that somebody who was maybe in an early or a later stage of their life who had different challenges, right? Maybe their kids were out of the house, or they had, their spouse was also sick. Like, we wanted to be able to show people that we represent and they are not alone, that they could find somebody that was that they could relate to, that they could say, hey, that person's going through the same exact thing that I'm going through. And so we really didn't have strict criteria. We just knew that there was a lot of people out there who were willing to share their story. And there was a lot of people who we wanted to make sure that we were representing. So it was a little bit of who was willing to share their story, but also making sure that we represented a swath of, our diverse country, and people who, it doesn't matter your age, race, where you live, you can face a cancer diagnosis. So we wanted to make sure that people felt like this was a welcoming place, and they felt like they could connect.
And respect those individuals who just want to go through the cancer journey privately without sharing their stories too. I'm sure there's a lot of people who also
100
would rather do that. Yeah.
Yeah, 100. We heard that a lot, actually. Like, hey, I'd love to be involved, but I want to do this on my own, or I'm not comfortable sharing my story publicly, but, I would love to understand what your platform's about. We definitely had a lot of that feedback too, which obviously we respect. Everyone is not going to want to go on camera and talk about their personal life. I think I would struggle with that personally if that was the case. And so just making sure that we were respectful of everyone that we worked with. And but I think we had a really great group of folks that show a diverse kind of population.
Yeah, I'd wager a lot of those people were probably guys who would pass on sharing their stories and just want to put their head down and plow through it.
Yeah, good bet.
Tom, can you share any feedback or data that shows how the platform has impacted people living with cancer, either in terms of emotional support or community building or awareness? Because all those things are so important when battling cancer.
Yeah, no, that's a great question. One thing that I love about my job and what I get to do outside of being able to promote this platform is the people I work with internally at Pfizer and the team that we have, our OPSA team, Oncology Patient Solutions and Alliances. I was joking earlier that we love our acronyms here at Pharma. But our team is really is a patient-centered and centric team. So we have a lot of different functions. And one of those functions is advocacy and professional relations. And they are the ones who are making the relationships with advocacy organizations, pulling through patient insights, working with those coalitions and organizations that really make a difference. And a lot of the feedback that we get actually gets filtered through that. And I'm in a very fortunate position that I have my finger on the pulse of lots of patients, and being able to get instant feedback to the platform that we have. And so we use a lot of those insights. And part of the reason why we're here still 10 years later is we're able to listen and understand what patients need and be able to pivot. Some of the metrics question and some of the data that goes behind that is, even these some odd years later and being able still listening to those patients, we're still driving a significant amount of people to our platform. And that is credit to the full team effort. And ultimately the most credit goes to the patients who are willing to give their time and say, hey, you know what? We don't think this is right. You shouldn't put a resource or a piece of content out about this topic, but how about this topic? And so we've really prided ourselves on listening to the patient feedback on a constant basis. And right now we're in the middle of our brand planning, tactical planning, where we're trying to figure out our plan for next year. And a lot of that is infused with patient insight. So it's a constant thing, constant feedback loop, but it's truly at the heart of what we do.
Yeah, it has to be. What have you found to be the biggest challenge? This is one of the questions, that always comes up when you talk about a program, how did it start and then how do you maintain it? But then what are the challenges you face when you're in the program or when the program is in full swing? So what have you found to be the biggest challenge? And, when you share a deeply personal story like your cancer journey, how do you, from a patient relation standpoint, and a communication standpoint in general, how do you face challenges in that space?
Yeah, no, it's hard. It's a hard place to be because people are, effectively sharing the deepest parts of their life with the world, essentially. the ones that have so graciously been a part of our platform, they're sharing every detail of their life, and that's hard. And we have to take it. I think empathy is a really great word, because we have to understand what they're going through in some aspect. So I think it's hard to find. You have to thread the needle when it comes to communications and how we promote this platform, but also making sure we're respectful of the real patients that are infused into this platform. So it is kind of a tightrope, right? Like we obviously want to make sure as many patients and caregivers come to this platform, but we also have to do that in a very sensible, respectful way, for the patients. But I also think too, there's other like bigger challenges that we face too. And that's patients and, from a kind of business side, right? Is this day and age, things change almost daily, right? There's a new tech. AI is obviously like the biggest thing in the world right now. And patients are smart. Like they are very smart and they understand really some very complex, not only just like about their own disease, but technology and how to consume media and how they want to be treated and talked to. Like they're smart. And I think a big challenge is how we approach that, how we can pivot, and how we can meet those needs of those of patients. I don't quote me on this stat, but so I won't give real numbers. But the difference from about 5 years ago, we looked at this study of attention span, right? So 2020 to now, and it was the decrease is like almost 50% in just 5 years from, let's call it, 10 seconds to 5 seconds or whatever. It is decreasing even more so. So our opportunity to grab someone's attention, to be able to show and communicate what our platform can bring is also another struggle that, unfortunately we just have to kind of navigate when we're trying to share our platform. But I think those three pillars are probably our biggest challenges that are ongoing. It's making sure that we're representing our patients well, and that their story, they're being heard, is respectful, and that that the way they want their story told is done in the right way. It's how do we have a lot of headwinds when it comes to ever changing technology in the world we live in. How do we face that? And then obviously, how do we contend with other things that are out there that patients are grabbing onto? So there's a few, but I think we're doing a good job.
Last question. What's next for This Is Living with Cancer? Are there any upcoming features, expansions, or collaborations you're especially excited about?
Yeah, I mean, my favorite thing in the world is to do advocacy partnerships with this platform. So that is an ongoing, forever growing type part of our platform, is finding new organizations, engaging with the ones that we already engage with, to find new ways, innovative ways to reach and engage with patients. It's always top of the list. We are a tech first type of organization. So we're trying to infuse different aspects of new technology into our platform. We just launched an AI search tool on our website. We have deeply invested into personalization. So if a patient does come to our site, they can enter a few different pieces of information like, hey, I'm interested in breast cancer and clinical trials. And the website will kind of spit out those specific topics for that person. So again, just making it easier for patients and caregivers to find the information. And then we're just always trying to, hear more diverse patient voice, right? So like, we started this journey with real patients and them telling their story about hope and inspiration, with the hopes that someone could connect with it. That hasn't stopped. That's probably equally the other half of why I love my job. And what I get to do is I get to work with real patients all the time. And I want their stories to be told. So we're always, looking for new stories to tell. We like to infuse technology because, like I said, patients are smart. They want to consume media just like everyone else. And we have to stay on top of that. And then just, enhancing our partnerships with advocacy organizations. That's kind of our bread and butter. So first of all, anyone who's listening or watching, please go visit thisislivingwithcancer.com. We also have a digital companion, a mobile app out there that is a really great kind of it accompanies this platform really well. And that, if you go to the App Store, is called Living With App. And then if anyone wants to engage with me and find me on LinkedIn, just Tom Butina on LinkedIn, working for Pfizer. Happy to engage with anyone who wants to chat more. But I really appreciate the time, Mike, and looking forward to connecting.
Thank you, Tom, and more importantly, thank you for what you do.
Awesome.
My name is Roy Barnes, and I'm now a country lawyer, practicing law. But for years I was in public service in Georgia, 22 years in the General Assembly, and 4 years as governor. Men are haphazard in their health care. And I admit it, we generally don't go to the doctor until it's too late. And particularly, we know from public policy that preventative health is the cheapest and it has the best results, because if you're in a preventative mode and you're educated about it, you will go to the doctor sooner. And that was the whole purpose of what we're trying to do. And in Georgia and in the South, and I'm sure throughout the country, but Georgia's the only one that I have studied over the years, there's a disproportionate effect on African American men than there are on any other group. And part of it is because of lack of access to health care. But a lot of it is just because of lack of knowledge. And that was what we intended to concentrate on and did when the Commission on Men's Health was formed. Remarkably, the chair of the Health and Human Services Committee in the House, Buddy Childers, he was from Rome, Georgia. He's still alive, but he had prostate cancer about the same time. And when I decided to do this, I called Buddy down to talk with me, and he was very enthusiastic about it because he said, I never knew anything about, being checked for PSA or anything else. And he said, says, I'm for it. Says, if you want to put it out there, I'll help you with it. And he became one of my big proponents in the General Assembly, and it was well received at the time. In public policy, it's always 2 steps forward and 1 step backwards. And so it's a slow process. The main thing that we did was on education. We had printed men's health issues. I think we distributed between 80 and 100,000. We created a lecture series where we went around. We had a men's health day and all of that. Yes, the gap still exists, and I attribute that to 2 things. One is that, again, lack of access to health care. A lack of primary care physicians is included in that. But those were the things that we were trying to do, and unfortunately, there's just not been the continuing focus on what is a health crisis, really. And now it has become very unpopular to talk about inequality. But to talk about the inequality of health care availability and the health care gaps that exist between women, all women, and men, and men, particularly on African American men.
As Governor Barnes discussed, advocacy helps break down these barriers by educating men and their families about the importance of early detection and healthy lifestyle choices. Thank you so much for joining us today. The My Cancer, My Plan podcast is just one of the many ways we connect with men and share helpful health information. Men's Health Network has tons of resources available to everyone. Just visit menshealthnetwork.org to check them out. We'd love for you to get involved by becoming a Men's Health Ambassador or simply subscribing to our newsletter. Both are available on our website. Also, be sure to check out Pfizer's Living with Cancer program. This is the program Tom was talking about that offers tools and resources to support anyone affected by cancer, including that free Living With mobile app to help manage day-to-day challenges. Again, that website is thisislivingwithcancer.com. And don't miss our next episode, Know Your Code, Biomarkers and Genetic Testing 101. We'll hear from Dr. Catherine Baker and two brave men who will share how these tests helped guide their treatment journeys. Tune in. You'll be inspired. At the end of each episode, we like to leave you with an inspiring health quote. This week's quote is, "Take care of your body. It's the only place you have to live." Again, thanks for listening, and we'll see you next time.